Good morning, everyone. Thank you for joining us today. This is the Rock County Public Health Department media briefing for October 14th, 2021. This briefing is being streamed live on the Rock County Public Health Department Facebook page. The recording will be available afterwards on our Facebook page and our YouTube channel. My name is Jessica Turner. I'm the communications specialist for the Rock County Public Health Department. Normally I turn my video on for these, but I've been having some technical difficulties lately. So to ensure the quality of the live stream, I'm going to keep my video off today. So let me introduce the other panelists that we have today. We have Nick Zupan, epidemiologist, Kelsey Cordova, one of our public health supervisors, and Seth Longcar, administrative services supervisor. So we will turn it over to Nick first, as we always do, for our data updates.
All right, thanks, Jessica. So in terms of our COVID-19 case activity, we're up to 19,301 Rock County residents have tested positive for COVID-19 over the course of the pandemic. Over the last week, we're averaging about 40 new cases per day. So we're still in the high threshold based on the CDC's determination of case activity, but we're seeing a little bit of a decrease. At the end of the week, last week, we were seeing about 50 new cases per day, and that's down to 40 as of yesterday. So hopefully we'll continue to see some slight decreases in case activity. Right now, we have about 890 active cases in Rock County, and there have been 214 deaths due to COVID-19. We have seen a slight uptick in our hospitalized patient numbers. Most recently, we had 21 patients in the hospital getting care for COVID-19. In terms of our vaccination levels, we have over 56% of our Rock County population has gotten at least one dose of the vaccine, and more than 53% have completed the vaccine series. So that's all the data that I have for this morning's call. So I'll turn it back over to you, Jessica.
Thank you, Nick. We are now going to go to Kelsey. Kelsey has some information for us on some contact tracing technology.
Thanks, Jessica. Today, we wanted to go over a few different systems available for contact tracing to help demonstrate how each works and how we use it. First, we have the Wisconsin Exposure Notification app. This app is a DHS tool that alerts users of the app if they have been in close contact with another user who has tested positive for COVID-19. The Wisconsin Exposure Notification app uses Bluetooth low energy technology, which is the kind that won't drain your battery, for anonymous exchange of Bluetooth keys with nearby smartphones that also have the app enabled. The Google and Apple exposure notification technology has built-in safeguards for user privacy. The keys exchanged with other smartphones are not linked to your identity or phone number and change every 10 to 20 minutes. The Wisconsin Exposure Notification app does not collect or store physical location or personal information. Neither location nor personal information will be shared with the Wisconsin Department of Health Services, Google, Apple, or other app users. Individuals who test positive for COVID-19 can report it in the app and choose to share the random keys from their device. Using these keys, the app will notify other app users who are nearby to the positive individual. This notification lets them know that they are a close contact and what to do next. Everyone can download and enable the app to help expand contact tracing and be aware when they may have had a close contact exposure. Android users can download Wisconsin Exposure Notification app from Google Play Store. iPhone users can enable the app from their settings by selecting and turning on exposure notifications for the United States and then Wisconsin. So the second contact tracing system we have available to us is Tell Your Contacts. Tell Your Contacts was started by a group of public health experts working closely with the CDC. The goal was to enable simple email and text communications for individuals to use to notify their contacts after testing positive for COVID-19. To use Tell Your Contacts, simply visit tellyourcontacts.org and select your preferences for notification. Either text or email, complete 4 sections of information, and click Submit. It only takes a couple of minutes. You can choose to write one of your own messages or send a standard written one for you. You can decide whether or not you want to include your name or stay anonymous. The system then sends a text or email to those contacts you've identified that might be at risk for COVID-19. The system does not ask for your personal information, nor does it store your contacts information. To use tellyourcontacts.org after testing positive, simply visit the site and follow the prompts. Tell Your Contacts is an essential tool in times of high transmission when the need for contact notification exceeds the capabilities of available contact tracers. We are currently experiencing high transmission and are operating under crisis standards. This means the public health department contact tracers may not be able to speak to every person who is tested positive, nor all of the contacts that are identified. If you test positive for COVID-19, we strongly encourage you to use Tell Your Contacts to notify people who you've had contact with for more than 15 minutes and were less than 6 feet away for 48 hours before you started feeling symptoms. The third contact tracing system is a new initiative that allows for automated communications to close contacts. We will be releasing a press release about this new option right after this briefing. In short, the automated communication system is technology enhancement from the Wisconsin Department of Health Services. Similar to Tell Your Contacts, this system is designed to notify via text or email the close contacts of someone who tests positive for COVID-19 in Wisconsin and notify them about their exposure. This new feature is another way to share important educational information with close contacts in a timely fashion. Individuals who test positive for COVID-19 in Wisconsin and Rock County will continue to receive a phone call from a contact tracer as available. Based on the information provided to contact tracers when talking to someone who has tested positive, the contact tracer can send an automated text or email message out to the close contacts the positive individual identified, saving a step for the person who tested positive and ensuring close contacts are notified in the most timely way. If you are the primary contact for a minor dependent, you may receive a notification on their behalf. The text message will be sent from 844-939-2782 and will read, Health Alert. You have been notified as a close contact to COVID-19. Links for more information and education will also be provided in the text. When clicking either the link, contacts will be brought to the Wisconsin Division of Public Health branded page. Emails and SMS messages will be sent out at 5 p.m. each day for all close contacts identified in the past 24 hours. Individuals without access to a cell phone with texting or an email will still receive a phone call. Please note, this new email and text notification system is different from the Wisconsin Notification app, which exchanges anonymous information with other phones that are near it for at least 15 minutes to allow people who have tested positive to send alerts to nearby phones. Both tools together will help notify a greater number of close contacts and provide the necessary education and next steps for staying safe. Contact tracing remains a valuable tool to stop the spread of COVID-19. If you test positive for COVID-19, in addition to staying home to protect others from further spread, it is very important that you answer phone calls or texts from the health department or DHS so contact tracing can proceed as quickly as possible. And that's all I have about the contact tracing technology.
Thank you, Kelsey. We will finally go to Seth for some additional updates before turning it over to the media for questions. Go ahead, Seth.
Thank you, Jessica. As we mentioned in our briefing 2 weeks ago, we are now providing COVID-19 vaccine clinics and COVID-19 plus flu vaccine clinics at area schools to make securing these critical vaccines more convenient and accessible for Rock County youth. The 3 latest vaccine clinics we have scheduled over the coming weeks are a COVID-19 plus flu vaccine clinic at Marshall Middle School in Janesville on October 18th from 4 p.m. to 7 p.m. A COVID-19 plus flu vaccination clinic with the Clinton School District hosted at Clinton Middle School on October 21st from 3:30 p.m. to 5:30 p.m. And the Evansville School District will host a COVID-19 vaccine-only clinic on October 29th from 12 p.m. to 5 p.m. We are partnering with the schools, Community Health Systems of Beloit, and AMI Expeditionary Healthcare to offer these clinics. They are free and open to the public, and walk-ins are welcome. At the clinics, COVID-19 vaccines will be available to those ages 12 and older, including adults, while flu vaccines will be available for children and teens ages 6 months to 18 years old. We are not able to administer flu adult vaccines at these clinics. Minors will need parental consent and should be accompanied by a parent or guardian. If a parent or guardian is not able to attend, they should call our COVID line at 608-352-6727 to discuss options. To register and learn more, please visit rockcountyshot.com and 211.com. We strongly encourage everyone to get their COVID-19 and flu vaccines administered together or separately to help us continue to reduce infection rates and related hospitalizations. Regarding booster shots, a few weeks ago, we shared the CDC, DHS, and Rock County Public Health Department recommendation for a Pfizer booster shot 6 months after the second dose for high-risk groups such as adults age 65 and older, all residents living in long-term care facilities, and adults ages 50 to 64 who are at high risk of severe COVID-19 due to underlying medical conditions. Today and tomorrow, the FDA Advisory Committee on Vaccines and Related Biological Products will be discussing the possibility of Moderna and J&J booster shots. If the advisory group recommends we go forward with Moderna and J&J boosters, their recommendation will go to the FDA for authorization, then to the Advisory Committee on Immunization Practices for review, and back to the CDC and ultimately to Wisconsin DHS for implementation. Pfizer's emergency use authorization request to administer their COVID-19 vaccine to 5 to 11-year-olds will also be reviewed October 26, following the same process, with more information likely available in early November. As always, we will keep you posted as we learn more. Last but certainly not least, today we want to remind everyone how important the COVID-19 vaccine is for pregnant women. In line with CDC recommendations, we strongly recommend that women who are planning to become pregnant get vaccinated for COVID-19. Across the nation, COVID-19 vaccination coverage for pregnant people remains low, yet pregnant and recently pregnant people with COVID-19 are at increased risk of severe illness, death, and pregnancy complications. Locally, we are seeing that pregnant women have a 3 times greater risk of hospitalization from COVID. Earlier this month, the CDC recommended urgent action to help protect pregnant people and their fetuses and infants and encourage vaccination. We strongly urge pregnant and recently pregnant women who are not already vaccinated to do so as quickly as possible. Back to you, Jessica.
Thank you, Seth. We will now go to media partners for questions. And it looks like today we have one media partner in attendance. It looks like we have someone from Beloit Daily News. I believe it's Austin. So we will give you the ability to mute and unmute yourself, and you can go ahead and ask any questions you have.
Thanks, Jessica. Just a few questions about contact tracing. I know we touched on some of the automated things that the county is using, but just wanted to talk specifically about how many staff with the health department conduct contact tracing, and just kind of what a day-to-day would look like for a contact tracer with the health department. Thanks.
I can take a stab at that one. Thanks, Austin. So in the Rock County Public Health Department, on any given day, we have approximately 20 to 25 staff working on disease investigation and contact tracing for COVID-19 and other communicable diseases in our county. The contact tracing process it has a couple of different pieces. So it starts with disease investigation. So we have a positive person. we've got to get in touch with that positive person and try to identify who they may have been in contact with during their infectious period. So we do the initial disease investigation with positive folks to get the contacts. So then we can start contact tracing investigations. We get in touch with all of the contacts, make sure that they know the recommendations for quarantine, all of the education material they need, resources for testing, vaccination, so that they can stay home, stay safe, monitor for symptoms, and know what to do if they develop symptoms, which is get tested or see their medical provider. So there's a lot of phone calls involved with the daily work of contact tracers, and it's all sort of tracing the transmission of COVID, starting from a positive person and going rings out to make sure we get in contact with everybody who they may have exposed and been in contact with.
Thanks. And then just my last question here, what are some of the biggest challenges facing contact tracing staff? Is that people just not responding, or just wanted to get a sense of what some of the biggest issues were if staff kind of run into dead ends related to contact tracing? Thanks.
Sure. So, you know, a critical piece to contact tracing and be able to get in touch, provide education and resources is making contact with individuals. So I think one of the barriers to contact tracing and being really successful and quick, which is a really important component to the process, is making sure that we get in touch with people either by email, by phone. So making sure that you're responsive to things coming from the Wisconsin Department of Health Services or your local public health jurisdiction is really important. Another barrier we have in contact tracing right now is just kind of the number of close contacts per positive person that we're seeing. So the volume of close contacts for every positive case exceeds the capacity of what we're able to do in a day. So the contact tracing technologies that we went over in the briefing help support the local health departments in making sure that everybody gets information that they need so we can help control the spread.
Thanks for your questions, Austin. Do you have any follow-up questions before we conclude?
No, I do not. Thank you very much.
Great. Thank you. And thank you so much for participating today, Austin. So now we will conclude today's media briefing. Just a reminder to everyone that these briefings take place every other Thursday at 11 a.m. They are live streamed on our Facebook page, and the recordings are made available afterwards on our Facebook page and our YouTube channel. I want to thank everyone who's been watching our live stream today. If you're a member of the media and you'd like to participate in future media briefings, you can send an email to me at media.publichealth@co.rock.wi.us, and I will provide you with the information that you need to participate. We'll see everyone again in 2 weeks. Be safe and be healthy.